I know you use Yin Tang in your practice all the time, because I do too. But so many students and new grads overlook the power of the extra points. Maybe because they're not taught in depth in TCM school. That could be the case. But here's the thing. These extra acupuncture points are not just extra bonus material. They're actually effective game changers in clinical practice. I've been practicing since 2003 and teaching future practitioners since 2008. I have seen how these extra acupuncture points deliver fast, effective results again and again. So today I am sharing the 15 top most used extra acupuncture points in practice, their location, their function, and some acupuncture combos utilizing those extra points that you are absolutely gonna love because they are so fantastic and powerful in practice. Welcome back to my channel. If it's your first time here, I'm Clara from Acupro Academy, and I create Chinese medicine and acupuncture content for students and practitioners, making it easy to grasp and fun to learn. Are you ready? Let's go. Before we start looking at the 15 most used extra acupuncture points in clinical practice, let's talk about how many extra points are there and what are they exactly? Extra point, also known as extraordinary or empirical points, are not located on the regular 12 meridians or on the 8 extra vessels. Obviously, all acupuncture points have pinyin or Chinese name, but in English, to facilitate our learning, we know that they have numbers like large intestine 4, stomach 36, lung 7, bladder 40, etc. Well, these extra acupuncture points do not have those same numbers following a meridian. However, they do have their Chinese name. They have corresponding numbers and initial in the World Health Organization. Extra point Yin Tang, which one of my patients called the Zen Button, which I love, is actually going to be on the World Health Organization as EX for extra and HN for head and neck, number 3. So it's extra HN3. That's literally how it's translated from Yin Tang. I'd rather keep it the pinyin and Chinese name than remembering head and neck, HN. You have the upper, lower limb, etc. They all have initials and a number to them, but I found that very difficult for me to remember. I'd rather remember the pinyin. So today, when I'm going to look at the 15 most extra point used in practice, it's all going to be in pinyin. These points were discovered over centuries, used by practitioners because they consistently produce great clinical results, even though they didn't fit neatly into the meridians theory. How many extra acupuncture points are there? Well, the results can vary depending on the textbook or the tradition, but here's a general breakdown for you. The World Health Organization recognizes over 90 standard extra acupuncture points. Peter Deadman's textbook, A Manual of Acupuncture, lists about 48 well-documented extra points. Chinese medicine classics and newer clinical sources may include over 100 extra points, some with regional or experimental use. However, in real-world practice, I would say specifically in the Western world, probably about 20 to 30 extra points are used regularly in practice. I thought it'd be great to start with the first 15 most used extra acupuncture points in practice. However, there are more, and if you think I miss one that you love to use in practice, please let me know in the comments below. As I said, let's start with the most popular, which is Yin Tang. It is located midway between the two medial ends of the two eyebrows. As I said, one of my patients calls it the Zen Button. It calms the mind for insomnia, anxiety, and those with too many thoughts. It is the third eye in the chakra system, so it's used a lot in Ayurveda and in the chakra system, right? So in the chakra system, it connects to enlightenment. This is where you can really get to focus when you meditate, right in that area. Because of its location, it also opens the nose for rhinitis, nasal congestion, and nosebleeds. It regulates wind for dizziness and convulsions. Now we're talking about internal wind. It also reduces high blood pressure and relieves, obviously, frontal headaches because, again, of its location. You can combine Yin Tang with so many other points that calm the mind. Obviously, always do your diagnosis and follow your TCM pattern for your patients, but for anxiety, for example, Yin Tang, REN 17, and pericardium 6, fabulous combo. If there's insomnia, we could do Yin Tang, Heart 7, and maybe Kidney 1, like Moxa Kidney 1. If there is a lot of overthinking and worrying constantly, and we need to calm the mind that way, Yin Tang with Spleen 5, great combo, because Spleen 5 is one of the best points when there is worry, overthinking, creating fatigue, mental and physical fatigue. So this is a great combo. If you haven't seen my video on the top acupuncture points to calm the mind, I'll have the link for you below. It's one of my most popular ones. Now let's look at Taiyang. It's 1 Sun posterior to the midpoint between the lateral end of the eyebrow and the outer canthus. Taiyang, because again of its location, is really good to be used for temporal headaches. It regulates wind for facial paralysis, Bell's palsy, and trigeminal neuralgia. So it can be part of a protocol for any of those, right? If there is temporal headache, I would add up obviously distal point like large intestine 4, maybe other points that are related to the gallbladder or liver, depending on your diagnosis. When it comes to facial paralysis or Bell's palsy for that matter, I would put a lot more points that are around the mouth, the eye, the cheeks, and the forehead. But obviously Taiyang can be part of it because of its location. And for trigeminal neuralgia, it is a very good point as well to combine with stomach 7. It also clears heat and brightens the eyes for red, swollen, and painful eyes, as well as eye twitch. All the points around the eyes actually have that same function. So it doesn't matter if it's bladder 2, stomach 1, Sanjiao 23, all those points are going to be really useful around the eye to clear heat and brighten the eyes, just like Taiyang. But I love to use it specifically for trigeminal neuralgia and temporal headache, obviously locally. The next extra point is not just 1, but it's actually 4 points. Se, Shen, Cong, which means for mind wisdom or for spirit wisdom, because Shen is the spirit, the mind, right? Those 4 points are on the vertex or the top of the head. Each of them are 1 Sun posterior, anterior, and lateral on each side of Do 20. Because it's around Do 20, it does a lot of the similar thing, but they're so powerful. You put those 4 points, and the way I needle them is I needle them all towards Do 20. So kind of like oblique towards Do 20, very shallow, 0.2 to 0.3. It's just a tap really if you use a tube. It's very shallow. They calm the mind for insomnia, irritability, and poor memory. There are not many points that can help with poor memory. Heart 7 is one of them, and Se Shen Cong is the other one. So really powerful point for that. Like most points on the head, it regulates internal wind for hemiplegia affecting the limbs, dizziness, vertigo, epilepsy, and vertex headaches. When it comes to internal wind, it can come from liver yin deficiency, liver yang rising, liver fire, or body fluid deficiency. And that will create internal liver wind. So we always have to try to figure out the diagnosis. We can use Se Shen Cong for any of those issues that I just listed, but at the same time, we want to follow the diagnosis. So let's say someone has dizziness due to liver yang rising, you want to add up liver 2 because that's the best point to bring the liver yang down, right? Or let's say someone has vertigo due to liver fire, then you really want to bring the fire down using fire clearing point like stomach 44, also large intestine 11, and of course liver 2 to bring that heat down. Make sense? So we want to always do a diagnosis, but these 4 points are fabulous to use in practice to calm the mind or, like I said, for internal wind. The next extra point is still on the head, and this is An Mian. An Mian means peaceful sleep. Oh, we know now what it does, right? So when you speak Chinese, everything makes much more sense than when you don't. It is located behind the ear, midway between Gallbladder 20 and Sanjiao 17. It calms the mind for insomnia because, of course, it's called peaceful sleep. It helps with irritability and hysteria. It's a really good point to use for menopause hysteria, actually, because women during menopause also suffer from insomnia. So this point is very useful. It is one of the best points for insomnia, specifically, of course, if you combine it with Heart 7. This one also regulates wind, internal wind, for high blood pressure, vertigo, and headaches that are temporal and occipital. I have to say, when someone comes specifically for insomnia, Mian is so useful and powerful with Heart 7, we have to put those two together. Now let's look at the next point, which is now below the head, on the upper back, neck area. It is Ding Shuang. Ding Shuang means calm wheezing. So we're going to see what it is used for. Again, knowing Chinese is so helpful. The location of Ding Shuang is 0.5 Tsun lateral to Du 14 at the lower border of the spinous process of the 7th cervical vertebrae, because we know Du 14 is below the lower border of the spinous process of C7. Of course, Ding Shuang stops wheezing for asthma, but also stops chronic cough. So we can use it specifically for children. You can cup it so you don't have to needle the child. And cupping Du 14 with Ding Shuang, because of course they're right next to each other, is very powerful for children with asthma, wheezing, and chronic cough. Now we can also use it for adults, of course. We can needle or cup the adults. When it comes to children, you can needle children, but it depends on how young they are. And if they're very, very young, then cupping is much easier and creates less drama. Ding Shuang relieves pain as well for upper back and neck pain because of its location, but every point relieves pain in the area they're located, so I don't need to go in depth on that one. The next one is Bi Tong. Bi Tong means painful nose, which makes sense because it's located at the highest point of the nasolabial groove near the nostril, very, very close to large intestine 20, just above it. So what do we use it? Exactly the same way as large intestine 20. It is for nasal congestion, sinusitis, rhinitis, anything affecting the nose, a lot of sinus pain. I would put Bi-Tong, large intestine 20, probably large intestine 4 because it helps with anything happening on the face and it expels pathogens. So that's a good combination. And if there was a lot of dampness with things like sinusitis or a lot of congestion, then we would also add up spleen 9. This is how we combine everything. Love me some Bi-Tong. All the graphics you are seeing today are from my book, Acupoint Made Easy. If you don't have your copy yet, it ships all over the world. And if you'd rather have the digital version, the PDF comes in with lots of video links to complement it, and you can download it on any device. It is one of my most popular books for students and practitioners alike. The link is below for you. Check it out. Now, let's go down to the trunk area. One of my favorite extra point that I use a lot because I treat a lot of women and a lot of fertility is extra point Zi, Gong. Zi means child or seed, and Gong is a palace. So it's the child palace or the seed palace, which means really it's like the uterus, right? It is really going to be more of a woman point. It is located 3 Tsun lateral to the midline and 4 Tsun below the navel. What does it do? As we said, because of its name, it regulates the uterus for irregular menses, abnormal uterine bleeding, dysmenorrhea, fertility issues, specifically when there is no ovulation, and it can be part of a protocol for uterus prolapse. So let's unpack this a little bit. When there's anovulation and we're trying to help the woman ovulate, we have to put the Gong because it is located literally where the ovaries are. So it really stimulates the area. We want to do a full diagnosis. Why is there anovulation? Is it a blood deficiency? Is it a blood stasis? What is the problem, right? So obviously we want to go in depth with our diagnosis, but we have to use the Gong. When it comes to uterus prolapse, I would combine the Gong with spleen 6, Ren 6, and Du 20 to lift. Now with prolapse, if it's stage 1 or 2, acupuncture and herbs are very powerful. If it's stage 3 and 4, it's a lot more difficult. So we have to have more information in order to see if we can help the patient or not. I had a patient that came to see me a few years ago that was going through menopause and had uterus prolapse stage 2. And I did exactly those points. Ran 6, spleen 6, do 20, and Gong. I did a full diagnosis. She was kidney yin and kidney yang deficient, so I added up kidney 3, kidney 6, spleen 6, did a full treatment. But I did use those points that are great for prolapse. And we did treatment twice a week. She also took a formula called Buzhong Ichitong, which helps in raise energy, but also is used for prolapse as well. And those two combined, within less than 4 sessions, she came back on the 5th session. We did this twice a week. And on the 5th session, she said, I woke up 2 nights ago because I literally felt my uterus go right back in. Like she said, it went like this, like it was pulled back in. She said it was the weirdest sensation. And we did a few more treatment and she had an ultrasound. And lo and behold, uterus was back in place. So acupuncture rocks all the way, baby. Woo! Okay, let's look at the back now. One of the points I use a lot in practice is Yao Yan. And Yao Yan basically is painful back, right? It is located 3.5 Tsuen lateral to the lower border of the spinous process of L4. And because of its location, it's one of the best extra points for low back pain or kidney deficiency, and this is TCM kidney deficiency, especially combined with bladder 25, bladder 40, bladder 23. That's a very good combo for low back pain. And Yao Yan is located by the piriformis, which a lot of time when there are back pain, this is the muscle that gets really affected. So very useful in practice. And if you haven't checked out the Acupuncture Musculoskeletal Guide online course, which covers the entire lower back, glutes, piriformis, like I just talked about, lower leg all the way to the foot, you've got to try this. This is such a great course which teaches you techniques, specifically needling technique like bone pecking, that you haven't learned in school. I'll have the link for you below. It is a fantastic course taught by my friend and colleague, Dr. Rebecca Stevens. The feedback on this course has been amazing because Dr. Stevens is a powerful teacher with so much knowledge. It'll change the way you treat pain in practice. The next extra point is again, not 1 point, but 17 pairs. Whoa! This is Hua Tuo Jia Ji. Hua Tuo Jia Jis are a series of points that are 0.5 Tsuen lateral to the low border of each spinous process of each vertebrae from T1, or the first thoracic vertebrae, to L5, or the 5th lumbar vertebrae. I love these points. You don't have to do all 17, but if you wanted to use just the upper thoracic Jiaji point to treat lung and heart condition, or the middle thoracic Jiaji points to address digestive system issue, or you can use the lumbar Jiaji, which are connected to the lower jiao, effectively helping or connecting to the kidney and bladder and sanjiao, large intestine, small intestine. But together, like I said, you can use them for spinal pain. They can also be used for shingles along the nerve dermatomes and organ dysfunction related to corresponding spinal segment. They also relax paraspinal muscles and improve circulation to nerve roots. These Jiaji points originate from the Chinese doctor Hua Tuo. Hua Tuo realized that needling besides each vertebrae could treat diseases of the related segment. We're talking about back shu, right? A lot of Chinese doctors, including myself, use the Jiaji point for imbalance in the zheng organ, spinal issue, paralysis, or anything happening post-injury to the spinal cord. They work really, really well in relaxing the muscle and specifically reducing or eliminating the pain. Let's now go to the limb. One of my favorite points is Jian Qian. Jian Qian is located between large intestine 15 and the anterior axillary fold. So really halfway between large intestine 15 and the armpit. That's what we're going to call it, right? Jian is one of my favorite points to help with frozen shoulder or any rotator cuff injury. My favorite combo when it comes to shoulder issues is Jian, large intestine 15, large intestine 14, Sanjiao 14, large intestine 11, and large intestine 4. So this is the whole shoulder, and you can do obviously the best distal point when there's shoulder problem, stomach 38. That is the best combo. For frozen shoulder, I usually do cupping to start with, then I will do some tuina and manipulation, very gently of course, then I'll do needling. After I remove the needles, I will do more tuina to see if the range of motion has increased. And doing this 2 to 3 times a week for frozen shoulder, that usually takes about a year for people to recover, will take about 2 months, which I think is unbelievable. Jian totally rocks, one of my favorite extra points. The next one is 2 points. R, Bai. R means 2, Bai means white. 2 white. They are located forward soon above the wrist crease on the anterior forearm on both sides of the flexor carpi radialis tendon. Those 2 points are fantastic. They regulate the large intestine for rectum prolapse and hemorrhoids. For rectum prolapse, I would combine RBI with bladder 57, do 20, spleen 6, ren 6. Fantastic. Now, for hemorrhoids, I would definitely combine RBI with bladder 57 and large intestine 4. Now, again, you can do a diagnosis for hemorrhoids to figure out your pattern and follow that as well. But these combo work so well in practice. Because of their location, they're very easy to acupressure, and I usually show patients to go home and do this a couple of times a day for about 30 seconds to 1 minute. That is going to be very helpful when the hemorrhoids are flaring up. Have you joined my weekly newsletter yet? I share exclusive content, tips and tricks on TCM and acupuncture I don't share anywhere else. So if you haven't yet, the link is below for you. It's completely free. You would love it. And if you don't, you can unsubscribe. I'm good with it. I promise you, you won't though. Now let's go on the lower leg and start with a common one, which is Xiy or Xiy Yan, which is the eye of the knee. And stomach 35 is the Xiy Yan, which is still the eye of the knee. One is on the lateral side, Y means lateral, and Ne means inner or medial side. So those are often needled together. So Xiy Yan is on the lower border of the patella in the depression medial to the patellar ligament. And stomach 35 is also on the lower border of the patella in the depression lateral to the patellar ligament. So we combine them very often, both together. They're called the eyes of the knee, and they are used obviously for anterior knee pain. So any kind of knee issue, I would combine stomach 35, Xiy Yan, gallbladder 34 because it's the best point for tendon, sinews, ligament, stomach 36 to help the healing process, plus where it's located, it's fantastic. And if there's swelling, spleen 9 because it is the best point to decrease swelling for excess dampness. Woohoo! So when you're treating knee pain, this is a really good combo to put together. And the way I needle stomach 35 and Xiy Yan is towards the top of the patella and center. So it's oblique towards the midline or the center of the patella and upwards. I'm going to group the next one because their function is very similar. We have Ba Xie. Ba means 8. And we have Ba Feng. Ba Xie are located between the web of all the fingers, so 4 on each side, so 8, and Ba Feng are located between the web of each toe. What do? They all are used for pain in the area. For Ba Feng, anything happening around the toes and the metatarsal area. For Ba Xie, anything happening around the fingers. Those are great points. How do I use those? I often use them when there's arthritis. If there's arthritis all over the hand, for example, using the Ba Xie points all in between the web. It's very powerful, specifically if you put some moxa as well. If the arthritis is a B syndrome due to cold or cold B syndrome. B syndrome is painful joint, and so that's what I would do. I would add moxa. It's the same on the feet. If there's pain, we can use the Ba Feng. I have to say I've used Ba Xie much more because I've had a lot of older people with arthritis in the fingers and the hand. Those are fabulous extra points used locally. These extra points are called Shi Shuang because Shi means 10 and there are 10 of them. They are at the tip of all our fingers. So the only one that's actually a point is pericardium 9 because pericardium 9 is at the tip of the middle finger. So it is also part of Shi Shuang. These 10 tip of fingers points are usually pricked to bleed, not needled, and they're used to revive consciousness for people that are in a coma, for high fever, and for convulsions. So this is something that is used a lot more in China, I think, than in North America because we don't see a lot of those cases in practice and clinic when people come and see us. But I wanted to mention them because they're very powerful in China and used a lot, and I think they should be mentioned. Even though in North America, I don't think we use them a lot, I have never used all 10 together. And if you have, let me know. I would love to hear your experience. The last extra point I wanted to share with you is not quite used a lot in practice, but it is very, very good. And we don't mention it enough, in my opinion. It is Dan Nang Shui. Dan Nang means gallbladder. So this is the gallbladder point. And its location is kind of like spleen 21. It's not quite sure where it is. You know how spleen 21 can be on the 6th or 7th intercostal space, depending on which one is more tender? Well, Dan Nang Shui, or the gallbladder point, extra point, is located 1 or 2 Tsun below gallbladder 34. You'll have to palpate on each patient and figure out which one is more tender, and that's where Dan Nang Shui would be located. Now, this point is really powerful as more of a Western gallbladder point. What does that mean? If there's any issue with someone had their gallbladder removed, or they have a lot of gallbladder issue and they've had gallbladder attack, or anything happening with the bile, this is a fantastic point to use. In practice, I see a lot of people that have had their gallbladder removed. So I use this point on them all the time because it supports the weak energy of the gallbladder now because they're missing the physical organ. Even though the energy of the gallbladder is still there in TCM perspective, the organ being gone means that the meridian and the gallbladder energy is weaker. So this is a really good point to support it. Fantastic, don't you think? I love it. Dan Nang Shui totally rocks. We went through 15 extra acupuncture points. There are many more, but those are the ones that I wanted to mention because they're so powerful and I use them a lot in clinical practice. Thank you so much for your support. I wanted to say that I'm so grateful. I receive daily messages from everyone telling me how my content is so useful and beneficial to them. It makes my day. I wanted to share one today from Facebook. This person bought one of my book. I don't know which one, but they said, just bought your book. Thank you for making my life and the lives of my patients better. This is why I continue to spend hours creating content and making sure you have resources to help you and your patient so acupuncture and TCM can change the world one patient at a time. As I mentioned earlier, the video I created on the most powerful acupuncture point to calm the mind is one of my most popular. Check it out if you haven't seen it yet. And no matter what, keep rocking it using TCM.